Coronary artery disease, also called CAD as an abbreviation, is a coronary disease that is the leading cause of death in the USA. It makes up about 15% of all US-related deaths, and 1 in 4 people who contract CAD will die. The disease occurs when plaque and fat builds up in the arteries. Arteries provide the heart with blood and oxygen. When they are blocked, your heart is unable to provide oxygen-rich red blood to the body and pump out carbon dioxide. This leads to several symptoms such as shortness of breath or having trouble breathing. A lack of fresh oxygen will cause you to be fatigued and tired. It would also start causing chest pain in the shoulders and arms. Lack of oxygen will also cause lightheadedness and a lack of direction or stability, which will then cause nausea. Some causes of coronary artery disease are old age, bad eating habits, heavy smoking, and heavy alcohol consumption, not to mention vaping and other inhaling drugs. What systems are affected by CAD? For starters, this disease affects the heart because it blocks it from doing its necessary functions. This puts a halt to the circulatory system and cardiovascular system as a whole, since the heart is the distribution center for oxygenated red blood cells. Since the oxygenated blood can't be passed through the body, the disease affects the respiratory system and lungs as well. You will have trouble breathing and being active because your heart can't pump blood fast enough. While there is no vaccine or permanent treatment for CAD, doctors will recommend doing the opposite of what I stated above. The first would be to quit smoking and alcohol. These two things are the cause of many problems in the world, and quite frankly, I don't see why they haven't been banned as of yet. If you want to avoid contracting CAD or other health problems, then you should eat healthy and get exercise. This will help train your heart muscle and make it stronger, faster, and more immune to diseases and infections. How do you diagnose CAD? The most common form of diagnosis is the CT scan. This scan checks for calcium in the arteries, and if there's a significant buildup of calcium or plaque, then CAD is likely. A CT coronary angiogram, in which you receive a contrast dye that is given by the IV during a CT scan, can produce detailed images of your heart arteries. One more form of treatment is the nuclear stress test. It measures blood flow to your heart and muscle at rest and during stress. A tracer is injected into your bloodstream, and special cameras can detect areas in your heart that receive less blood flow. Some technology used in the NST, as mentioned above, is a small tracer equipped with a camera. An angiography is when a doctor can look into your arteries and determine the blood flow. It uses an OCT, which is a high-res camera attached to a tether, which is remote controlled to look into your veins and arteries to create a cross-sectional image of the artery lumen and wall. This is everything you need to know about coronary heart disease, its causes, potential treatments, and diagnosis. I hope you enjoyed this presentation.